I'm Mary Jane Betlehem, Stomal Therapy Nurse at St Vincent's Private Hospital, Melbourne. I've been working in that role there for about 10 years, but I've been working as a colorectal nurse for probably 25 years now. Yeah. Well, using Convexity where appropriate for many years. Certainly back when I started working in the area, we didn't have Convexity, so we had to sort of make our own, and that would be using a flat appliance with a seal and various other bits and pieces. You had to be pretty creative, but nowadays we're spoilt for choice really. There are various different sorts of Convexity and we need all of them, and we're very lucky to have them. So it doesn't just depend on the type of stoma, but certainly the type of output you've got from that stoma, which would inform what we would use. Well, again, as I said earlier, spoilt for choice. There are so many different brands, so many different types, and the evolution of that is probably the material that it's made of. Certainly a cut to fit Convexity is great for starters, but really targeted Convexity where you get the push where you need it, so pre-cut, that's really one of the best things ever. And there are varying different types of Convexity, as we said before, soft and firm. You really just have to judge, as I said, not so much the stoma itself, but the output from the stoma as well. The abdominal skin folds, the abdominal plane, how that changes in a post-operative patient. So when we send them home, their abdomen 2 weeks later may look totally different, and where they weren't needing Convexity to begin with, they then may need it. So we don't necessarily end up using the bag we send them home in, and it's important to tell that to the patient too, so they don't think, does this person actually know what they're doing? They keep changing their mind all the time. I do say to them, I'm sending you home in this, but I might change my mind in a couple of weeks. But the process is the same for any bag you use. We're just changing to suit your needs. Well, certainly in my practice, I don't use Convexity from day one necessarily. I think the patient's abdomen is often very swollen and edematous. They're often very sensitive and uncomfortable, and any pressure at all may not be the best thing for the patient. So I would probably wait till day 2 or 3, and then certainly with a loop ileostomy, we sort of know anecdotally that sending a patient home without some form of Convexity is probably not a great idea. So I would probably just go straight to that. With a colostomate, I usually start off with a flat and not worry about it until I see otherwise. Urostomates, well, because it's urine, it will follow the line of least resistance, this we know, and if they have a large abdomen or any skin folds or creases, then certainly I would use Convexity for that. Yep. Well, certainly the patient first and foremost. What we don't want, as I always say to patients as I'm discharging them, you do this any way you want. I'll show you how I teach everybody else, but how you do it is up to you. But my bottom line is, we don't want red sore skin and we don't want leaks, and they certainly don't either. So that would be my reason for using Convexity. Certainly it makes my job easier if they're not having skin problems or leaks, so it works for both of us.